Hello, welcome back. Today we'll be looking at a very important topic, which is the axillary artery. This video today, I'll be focusing on writing essays in anatomy, and the essay we'll be looking at today is essay that concerns the axillary artery. I'll be giving you interesting mnemonics that can help you write essays, form outlines, and write essays that can fetch you a lot of mark when you are asked to write on any structure in the body. So today our focus will be on the axillary artery. Now, this is a possible question that can be asked in your exam. Give an account of the origin, the relations, and the branches of the axillary artery. They can also ask you to write short notes about the axillary artery. And here is a mnemonic that can help you form an outline when you're asked to write about the axillary artery. And this mnemonic is just in one sentence, which is, I only carry strong books regularly, calmly. This mnemonic won't just help you to write on axillary artery, it can also help you to write on the structure I call the transit structure. Structure that start from a point and end at another point in the body. So all these structures that are transit in the body, with the mnemonic I only carry strong books regularly, calmly, you can write outlines, you can form outlines that can guide your essay when you're asked to write an essay about these structures. And the I is introduction. O in only represent origin. C in carry represent cause. S in strong represent structure. B in books represent branches. R in regularly represent relation. C it represent the clinical correlates, correlation, and conclusion. Now with this, our introduction is the axillary artery is a major blood vessel that supplies the upper limb, thorax, and the shoulder region. Now, origin. The axillary artery is a continuation of the subclavian artery because it extends from the outer border of the first rib to the lower border of the teres major, where it continues as the brachial artery. Now, the pectoralis minor crosses this artery and divides it into three parts, which is the first part, superior, proximal to the muscle, the second part, posterior, deep to the muscle, and the third part, inferior, distal to the muscle. So, okay, we have the pectoralis major and the pectoralis minor in the human body, and here is just a simple phrase and sentence that can help you remember which of the pectoralis muscle crosses axillary artery to divide it into three three parts. The first is minor divides major covers. So the P minor is what divides the axillary artery into three parts. You can also think of the smaller muscle make the bigger secured. The smaller muscle make the bigger secure, which is the smaller for minor, bigger for axillary artery. The smaller muscle, the pectoralis minor covers the divides the axillary artery into three parts. So with these two mnemonics here, you can actually know which muscles, in case you are asked in your multiple choice question, which of the following muscles that divides the axilla into three parts with just minor divides major covers. You can also remember that it's the pectoralis minor that divides the axillary artery into three parts. Now the next is the structure. Always remember to draw and label any structure or any organ asked in an essay in anatomy. It will fetch you 3 marks. So always draw and label. Learn how to draw. It mustn't be very beautiful, but just learn how to draw something and label that structure. Now the next is the branches, and I have a mnemonic here that can help you remember the branches of the axillary artery. And this mnemonic is just a simple sentence. Say, screw the lawyer, save a patient. Screw the lawyer, save a patient. F in screw represents the superior thoracic artery, which is the first part. T in D represents Thoracoacromial artery, which is from the second part. L in lower represent the lateral thoracic artery, which is from the second part. S in C represent the subscapular artery, which is from the third part. A in A represent anterior circumflex humeral artery, which is from the third part. And finally, P in patient represent posterior circumflex humeral artery, which is from the third part. So this mnemonic, screw the lawyer save a patient, can help you know the different branches of the axillary artery. Now next is the relation. Now with anytime you are asked to talk about the relation of a structure that is in transit, you must always talk about this relation according to the location of that structure at a particular point in time. Like for the axilla, we can talk about the relation of the first part, then the relations of the second part, then the relations of the third part. Now for the first part, the relation of the first part is one, the anterior relations are the skin, the superior facials, and the deep facials. The posterior relations is the first intercostal space. The lateral relation is the lateral and posterior cords of the brachial plexus, and the medial relations is the axillary vein. Okay, here is a diagram showing these relations in details. You can pause this video to take a good look at this diagram. It will help you understand the relation of the first part of the axillary artery. Now for the second part of the axillary artery, the anterior relation is plus. As the plus there represents the skin, the superficial fascia, and the deep fascia that is also seen in the first part, plus the pectoralis major and pectoralis minor. The posterior relation is the subscapularis. The lateral relations are the lateral cord of the brachial plexus and the coracobrachialis. The medial relation is axillary vein. And you can pause the video to look at this diagram that shows the posterior relation of the second part of the axillary artery. Now next is the third part of the axillary artery. The arterial relation is still the skin, the superficial fascia, and the deep fascia. The posterior relation are the radial nerve and the subscapularis. The lateral relation is the coracobrachialis, and the medial relation is the axillary vein. One thing you must know about these relations is that the axillary vein alongside with other structure form the medial relation of the axillary artery, while the nerves, like the branches of the brachial plexus, forms the lateral relations of the axillary artery. Now, the anterior relations can be remembered with the skin, the deep fascia, and the superficial fascia, with other structures that can be seen in that particular part. I'm just listing few of them. You don't need to know all the structures. If you can know few, it will fetch you the marks you need to get in that question. So that's why I'm just giving you few of the relations. You don't need to cram all, you don't need to memorize all the relations of a particular part. Just know one or two, and to give you the marks you are trying to get from that part. Now this is a diagram showing the relation of the third part of the axilla. You can pause the video to look at the diagram. Now the next part of the mnemonic is clinical correlation and conclusion, which is C. As a preclinical student, you might not be required to know much or a lot of the clinical correlation, but just knowing one or two can fetch you some points in your exam. So I just listed three, so you can know one or two, and it will help you get 3 points in your exam. The first clinical correlation is trauma and injury, then fracture of the axillary, the clavicle, or the proximal humerus can cause damage to the axillary artery, leading to ischemia in the upper limb. The next is aneurysm. Aneurysm is when the axillary artery, when there's aneurysm of the axillary artery, it can cause compression, because aneurysm is dilatation of the blood vessel. So when there's dilatation of the blood vessel, it can cause compression or on other adjacent structures. Like for instance, if there's aneurysm of the axillary artery, it can cause compression on the brachial plexus, causing pain, numbness, and weakness in the arm. The next is axillary artery occlusion. Axillary artery occlusion in case of arteriosclerosis, in case of embolism, in case of trauma, can lead to the supply of blood to the upper limb, and this can cause ischemia. So with this can form our clinical correlates of the axillary artery. Knowing one or two of these can give you 3 points in your exam. The next is conclusion. The conclusion part of this is that the axillary artery is a key blood vessel supplying the upper limb and the thorax. So I'm not supposed to tell you that you don't need to know much, you don't need to memorize a lot of things when you want to conclude an essay. Knowing the function of what you are talking about can form your conclusion. Knowing the function of what you are talking about can form your conclusion. You don't need to memorize anything. You don't need to memorize anything when you want to conclude an essay. So if this mnemonic now can help you write an essay about the axillary artery and other mnemonics in this video, if they were helpful, please like this video, share, subscribe, turn on the notification bell so that you get notified when I post interesting content. Keep reading, keep working hard, it will end in praise. Thank you for watching.